Good afternoon, everyone. Elisa Haushalter, Director of the Shelby County Health Department. I want to welcome you to the Joint Task Force update. Today I'm going to give very few data updates. I want to spend more time really giving updates on vaccine and where we are in the phases. And then Dr. Randolph will give some additional updates and specifically talk about events that should or should not occur this weekend. And then Chief McGowan will finish us out giving some reflections on the past year and looking forward to the new year. As of this morning, we have 67,198 cases, and that's an increase of 761. We do know that the numbers were down for a few days because there was less testing over the Christmas holiday. So the 761 is a more accurate reflection of where we are at the current time in the pandemic. And unfortunately, we've had 891 deaths, and 14 of those were reported in the last 24 hours. We're continuing to run an average of new cases per day above 500, and our positivity rate continues to be above 12%. Our reproductive rate is slightly above 1%. So those are all areas we're continuing to focus on. We're also still continuing to encourage people to get tested, know your status. There's plenty of capacity locally, so we encourage you to get tested as quickly and as often as possible. But we really do want to spend more time on vaccine distribution. Obviously, Shelby County has been receiving vaccine not only through the healthcare systems, but through the health department. And this week has been focused on Category 1A1, which is primarily first responders and a very select group of individuals. We do know that there have been some people who have showed up at sites to get vaccine, but we're really encouraging people to pay attention to the categories that are eligible for vaccine. Those categories were developed in partnership with the state health department, but also federal guidance to really target those individuals who are most at risk, one, of contracting COVID, but also of potentially spreading COVID to others. And so first responders and healthcare workers are very important to get all of their vaccine first, and that's to ensure that they can continue to provide services to the community. We will likely, because of the size of our community, focus on that population for this week and next week, but we are opening up to one portion of Category 1A2, which is funeral directors. So beginning today at noon, those who work in the mortuary sciences or serve as funeral directors are able to get their vaccine. They can go either to the Sycamore View site or the Lindenwood site. Both of those are posted on shelby.community. And then we will also be sending a communication out so that those individuals can schedule a time for vaccine. Lastly, I just want to highlight the weather has been bad, obviously yesterday and today. We do anticipate that tomorrow we are not going to open the Lindenwood site, and all individuals who are scheduled for vaccine tomorrow on the 1st of January are asked to go to 1826 Sycamore View, and we will provide the vaccine there. You will also receive notice if you signed up through Eventbrite that we've had to change that location. The other change is that tomorrow, again because of the bad weather the last 2 days, but anticipated winds tomorrow, we will be doing the vaccine inside the Sycamore View site, not as a drive-through. So please anticipate that you'll need to park and come in for vaccine. I know there will be a lot of questions about vaccine, so I'll cut it short here and turn it over to Dr. Randolph. Thank you.
Thank you, Dr. Haushalter. Greetings, fellow citizens of Shelby County, Abarigani, those who celebrate Kwanzaa. The sixth day of Kwanzaa is Kuamba, which is creativity. And I just want to spend a little time just talking about some safe and creative ways that we encourage you to bring in the new year. As we well know, today is December 31st. New Year's Eve. A lot of events are being planned throughout the city, but I want to remind everyone that restaurants and businesses are closed at 10 o'clock. And I've received some notifications where there's been advertisement of events occurring after 10. And I just want to put all those who are planning to have events after 10 on notice that that is in violation of the health directive. And we will be out patrolling and enforcing to the best of our ability, making sure that you are not operating beyond 10 o'clock in violation of the health directive. But more importantly, I want to just take this time to really encourage each and every one of you to remain steadfast and really remain compliant with the safety measures that we've outlined. For the next 22 days, we're asking that you stay home as much as possible and that you avoid large gatherings, large crowds, and that if all possible, we're asking employers to allow their employees to work in remote areas at home, alternative work sites. In essence, what we're trying to do is to just avoid crowding and gathering so that we can limit the transmission of this virus. I want to just say also that if you go out and hang out and are around crowds, you almost should consider yourself infected and should behave sort of like you could well be infected, and therefore you should quarantine and you should get tested and you should avoid being around those who are vulnerable. So as we bring in the new year, I'm just asking that you not go out, celebrate and bring in the new year and bring home the virus to loved ones, or start the new year out with an infection with the coronavirus. So with that, I bid you a happy new year to everyone and be safe. Now I'm going to turn it over to Chief McGowan.
Well, thank you, Dr. Randolph, and thank you, Dr. Haushalter, Doug McGowan, with the City of Memphis, and representing the Joint Task Force today. Today's December 31st, and some 300 days ago, leaders from across the entire region were briefed by Dr. Haushalter and Dr. Randolph on what were then the first diagnosed cases of COVID-19 in Memphis and Shelby County. Only 1 week later, our elected officials decided to come together under a joint task force structure to coordinate what really has been a Herculean effort to inform, to protect, to feed, to teach, to support, to test, and yes, even now to vaccinate our entire community. And so as we reach the end of this year, I can't help but take a minute just to reflect on the road that we've traveled. From the start, our objective has been, and it remains to this day, to navigate the pandemic so that we're able to return to a new normal, and make no mistake, it will be a new normal, as quickly as we possibly can, but doing so while we preserve lives and we preserve our livelihoods. It hadn't been easy. We haven't always gotten it exactly right. And while we haven't always agreed, what we have done is delivered what has been to this point a unified approach across our entire region to combating this pandemic. For all too many of us, we have felt the stinging loss of family and friends who've succumbed to this disease, and today I know I'm reflecting, and I think many of us are reflecting on what those family members meant to us, what those friends meant to us, and today we mourn their passing. I hope that you, like me, will take some solace in knowing that because of the way that this community has collectively risen to face this pandemic, that the death rate in Shelby County is less than half what it is across the nation. And while our state is a hot spot in the country, Memphis and Shelby County remain in the bottom 5 of the 95 counties that make up the state of Tennessee. And that's because of you all coming together to follow the directions that the health department and your elected officials have given us. Our medical experts have come together to create new and innovative ways to make sure that everybody has had free and ready access to testing, despite other areas of the country and even in our own state where there has been a scarcity of testing and there have been long turnaround times. We have not suffered that here. Our hospital systems are certainly stressed, but they are managing their caseloads minute by minute to make sure that those among us who are in most need of critical acute care are able to get it when they need it. And one of the things I'm most proud of is that our community has come together and answered the call for volunteers. More than 1,000 people have stepped forward now to say, I'm willing to help. And they've done that by signing up for the Medical Reserve Corps. They've come and answered our Indeed ads, but they are providing blessed relief to the folks who are on the front lines. And as importantly, you just heard Dr. Householder and Dr. Randolph mention that we have begun the life-saving work of administering vaccines, and we are not going to stop until everyone in Memphis and Shelby County can be immunized. Now, I've had the good fortune of keeping in close contact with my colleagues across the country in other large cities in America, and I can tell you this. When they hear about how we as a community have stood up, how we have been unified and not fractured, and how we have responded, they are incredibly jealous of what we have here. Now, I know it might not feel like it, but things could be incredibly bad if we had not had this kind of an approach. And I want to give a lot of credit to our elected officials who have allowed this to happen. You know, if they had not checked their egos at the door, if they had not broken down every stovepipe and decided instead to roll up their sleeves and come together to work, we would not be where we are, folks. And that goes for the folks all the way as northwest as Brownsville to West Memphis, over to Fayette County, and all over Memphis and Shelby County and the municipality. So a lot of credit to our elected officials. We are blessed to have you all. It's not just about the pandemic, though. Along the way, we've somehow allowed life to continue. Our community took action early on in this pandemic, and we found a new way that our children could learn. And not just in remote and sometimes part-time learning, but to make sure that every child had access to the technology that allowed them to continue to learn no matter what their circumstance was. And because we had an outbreak in our nutritional center early in the pandemic, and we were at risk of not being able to provide food for kids who desperately need it, and they rely on the schools for that, our task force came together and made sure that food was readily available for every child without skipping a beat. And because so many of our parents rely on schools so that they can go and make a living, our agencies came forward, stepped up, and found a way to provide remote learning academies, daycare provision, and it wasn't just the YMCA and the community centers and everybody else who we are so blessed to have them in our community, but it was also you, the friends, the neighbors, the grandparents, the aunts and uncles who came together to allow folks to go back to work while you were caring for their children. And we couldn't be more appreciative for that. Many of you may not know, but Memphis has been designated as the most benevolent city in the country year after year after year for the rate of giving. And through the city of Memphis, Shelby County, and the COVID-19 Regional Response Fund that has stood up at the Community Foundation of Greater Memphis, together we have issued forth more than $20 million of support to individuals and organizations in the form of rent assistance, utility assistance, mortgage assistance, business stabilization grants, and grants to nonprofits who do the great work of providing social services for so many who need it. And while we were doing that, we also ensured that we took care of people who were not just chronically homeless, but newly homeless, to make sure that they had a place where they could find some rest and they could also be safe and isolate from COVID. I'm very proud of the fact that our food bank has provided food more than 40 million meals to families during the time of this pandemic over the last year, and also provided a ready source of nutritional food for everyone who needs it, no matter what their station in life. And all through this, we actually completed a 10-year census, and we counted every single person in Memphis and Shelby County. We made it through a presidential election. And we also, today, will be transitioning several parts of the city of Memphis through de-annexation back to unincorporated Shelby County which is a significant effort as well. And I think we should all be proud that during the time of the pandemic, while other cities suffered months of violent protests, here in Memphis and Shelby County, our community came together to peacefully let our voices be heard. And we continue to reimagine policing for the residents of Memphis and Shelby County. So we're closing out 2020, which has been a year of collective and individual sacrifice. But over the last 300 days, I have been personally inspired by our collective grit and our broad commitment to doing the right things as we grind our way through this pandemic. It's my hope that we're going to enter the new year with a great sense of optimism in the face of some of the daunting numbers that you have heard and you will see on the reports. But you'll know that there is light at the end of the tunnel. And the light at the end of the tunnel are vaccines that are life-saving. And when they are combined with face masks, they are the key to ending this pandemic and having a wonderful new normal. Now, there's still work to do, and our journey isn't over. We still need your help. We still have many, many more people to vaccinate, and we'll be doing that work for the better part of 2021. A lot of work in the beginning of the year, but our work may not be finished as we get through the summer. Vaccination, testing, mask wearing, and adherence to what Dr. Randolph and Dr. Householder put forth as directives are the keys to ending the pandemic. Also, your help. If you'd like to get more involved, please sign up for the Medical Reserve Corps. I think we have the link on the screen there. If you'd like to donate, we could still use your donations. The COVID-19 Regional Response Fund at the Community Foundation. You heard Dr. Coopwood talk last week about the Pay It Forward campaign. If you would like to do that, the Community Foundation can direct your contribution there. I look forward to the promise that the new year brings, and I hope that you and your family have a safe, happy, and prosperous new year. We'll stop and take questions.
Siobhan Riley, Fox 13.
Yes, I was wondering if the county continues to see improvement in COVID cases, do you think that you will lax the restrictions in the next several days?
We're going to continue to monitor the data, but I don't anticipate we're going to lift any restrictions in the next couple days. What we committed to was continue to monitor the data and look at it at a 2-week mark and see where we are at that point. But obviously we anticipated from the beginning that it would take up to 2 incubation cycles to see some changes. We also knew that testing would go down over Christmas, and so those numbers of cases for several days really are not a reflection of the actual cases. And then lastly, because of the bombing in Nashville, there was actually some interruptions in the data flow, so we want to make sure all that's corrected and that we have accurate data before we make any final decisions. You have a follow-up?
Yes, we're getting a lot of phone calls from people who are saying that there are a lot of people who got vaccinated who were not supposed to get vaccinated. Just wanted to know what steps the department is taking to make sure that doesn't keep happening.
Sure. So I actually want to make sure I use the language that I think is accurate. There isn't a supposed to or not supposed to group. The way the state health department set the categories, they are priority categories. That means individuals in these categories should be prioritized. But we also had guidance regarding either turning people away or not turning people away. So I want to assure the public that we adhere to all guidance that the state of Tennessee gave us in providing the vaccine to us. What we do know happened is that individuals got on social media and began to say that the pods were open when in fact they were not. And so then we began to turn people away. What we will continue to do is, one, give notice to the groups that actually are eligible or prioritized. That was done initially through a variety of channels to the first responders. We'll continue to give notice to those groups. We will also give daily updates and let the public know which groups are being prioritized for those particular pods on those days. And then we'll make announcements here at the press conference as well. But I also want people to know it is fluid. So an example is we are still vaccinating category 1A1, but we know we have some open slots. So we made a decision to say those who are in category 1A2 that work in the mortuary sciences industry can come forward for vaccine. So I really encourage people to continue to pay attention to Shelby.community as well as our daily updates to know which groups are eligible for vaccine. After the first of the year, it'll be a much broader group that is open, and so we anticipate that there may continue to be people who show up that don't fall into those categories. I'm asking people to please respect the priority process and only come forward when your group is eligible for vaccine. Thank you.
Brad Broders, Local 24.
Happy New Year, everyone. Following up, Dr. Househalter, just sort of segueing what you just finished saying. I know it's fluid. I know different counties have different parts of the process. But as we turn to 2021, what do you think the groups can expect to be vaccinated kind of down the line? Do you have any kind of timeline on that?
Sure, and Happy New Year to you as well. The one thing that's really different about Shelby County that I ask people to take into consideration, we are the largest county. And so the surrounding counties, when they look at their first responders, that's really a small number of people. Well, we may have thousands, and so we will likely be in priority categories for longer periods of time just because of our population. And then we will be monitoring really day to day which slots are open so that we don't have any wasted capacity and that we don't have any wasted vaccine. And so we will then be making announcements opening it up to other groups. But clearly we've already said we're opening it up to a portion of 1A2. We will likely open up the remainder of 1A2 shortly after the new year. And then that also includes those individuals who are above 75. What we're looking to do also is to make sure that we have the ability to be in different parts of the community because we want to make sure there's equitable access and that all people who fall into those categories can access whether they have transportation or don't have transportation. So you also see some movement of the sites so that we can assure access. You have a follow-up?
Yes, Dr. Househalter, thank you. Just this might be more for Dr. Randolph, but just if you could kind of follow up more on the planned enforcement tonight, and have there been any other businesses that have been temporarily closed in recent days?
Sure, I'm going to let Dr. Randolph follow up on that one. Thank you.
To answer your second question, we have not had any closures of recent days. And I really want to just reiterate, we're not in the business of closing businesses for the sake of closing businesses. We really prefer providing technical assistance and helping businesses to comply with the safety measures in the health directive so they can operate in a safe manner. We're only closed when we absolutely have to. Our efforts today, tonight, and this weekend would be as they have been in the previous weekend. We will have accompanying us law enforcement officers that will assist, if need be, in our attempt to enforce the health directives. We are strongly encouraging that folk will adhere and that we do not have to close, but if we enter into a place that we feel to be an imminent threat, and that is people are just grossly violating the health directive, no one wearing their masks, they're not socially distanced, then we do have the authority and will exercise it to close that event. If we find folk who are open beyond 10 o'clock, we also will close immediately because you're violating the health directive. Is there a follow-up?
That was his. Max Garland, Commercial Appeal.
Yes, I was wondering, the pace of COVID-19 vaccinations throughout the country has been slower than expected in the early going. So is that the case in Shelby County as well? And if so, how off pace are we, and what is the main contributor to that?
I'm going to let Dr. Haushalter answer that.
Our experience thus far hasn't been that there's slow uptake. We've already given over 3,700 vaccinations just through the health department. Our healthcare partners and healthcare systems have been using up all their vaccine. When we open it up to the general public, there's always a concern that there will be what's called vaccine hesitancy. So there's a lot of efforts underway to make sure that we're reaching out to the community, understanding what their concerns are, and being able to answer those questions and concerns that they have so that we have sufficient uptake. What we did notice is what we expected. Usually you have early adopters, so those people who were eagerly awaiting the vaccine got in line the first day or two, and then it starts to wane in those categories. That's why we said we'll open it up based on monitoring. So at the current time, we're not seeing a large amount of vaccine hesitancy, but we anticipate that will be a challenge as we move forward. And again, we'll work on communications, and we're doing that all collectively. I really will rely heavily on the media to get out accurate information so that people do have reliable, consistent, and accurate information about the vaccine. You have a follow-up?
Yes, I was wondering also, Colorado and California have confirmed they have cases of the more infectious COVID strain seen in the UK. Is it likely this strain will be detected in Shelby County or in Tennessee at some point? And if so, how does that affect efforts to combat the pandemic?
So that's a great question. At the current time, we don't have any confirmed cases locally. However, there's extensive conversations amongst the laboratories to determine how they can do testing here and how it can be consistent from lab to lab to have early detection if we potentially have that strain here locally. We do know, based on the UK information, one of two things. One, it's either more transmissible or it's more virulent, and so that if somebody gets infected, it doesn't take as much of the strain to be able to cause the infection. Regardless, what that means is that if you get that strain, it's going to spread more quickly, and more people will be ill and shedding the virus. It doesn't change the overall strategy. So we still want to really focus heavily on testing. It's really critical then to have that quick lab turnaround so that if we detect the strain, we know that quickly locally. We'll continue to do contact tracing. We may change some of the contact tracing. For example, we'll have different questions because we need to know if people traveled, didn't travel, so on and so forth, and really continue to focus heavily on isolation and quarantine. We'll give notice to the public when we know we have cases here, because it's going to be critical to be isolated if you have that strain. It's critical anyway, but more so with this strain. And then lastly, I'm actually going to quote Dr. McCullers. We talked at length earlier in the week about this particular strain, and the most important strategy we can implement locally is to reduce transmission. So all of the efforts we have currently that are the restrictions community-wide reduce that transmission, and that's where we'll continue to focus. Thank you.
Greg Akers, Memphis Business Journal.
Hi, Happy New Year. Regarding those priority categories and the limited numbers of vaccines, do you have an idea of how many people are within each occupational group and priority level who are eligible to get it?
So we do have that information. I apologize, I don't have it with me. That is looked at in each county from the state level. So the state uses employment data and then calculated for each community what they anticipated in each of those categories.
Thank you. And one follow-up. Do you ask that people who are eligible but have decided that they don't want to get it, do you ask that they let you know that?
No. What has happened, and it's happened through various businesses and some public surveys, is we've asked people what category they fall into, whether they're likely to get the vaccine, not likely, or still questioning whether they're going to get the vaccine, to be able to provide as much information and education as we can so that we get increased numbers in those particular target groups.
We are out of time. Are there any closing messages?
I want to leave, you want to add anything at the end of?
So I'll just close with a couple of things. I realize that there's urgency and interest for everybody to get a vaccine, but please give the health department time to get to 1A1. There are 50,000 healthcare workers in this community. There are 6,000 first responders. There are many, many people in congregate settings. And so you heard Dr. Householder, we've given 3,700 vaccines. That should give you an indication. It's going to take us a while to get through this group. So look for the facts. Social media does not always share the most accurate information. Just because somebody snuck through doesn't mean everybody should go through. We do encourage people to get vaccinated. Dr. Householder has given you very good guidance there, that there are other groups that we can pull in as we need to, but please temper your excitement and we will get to you. And the second thing is just a personal plea. Dr. Randolph had a question about enforcement. Folks, just do the right thing. If you are together with a large group of people and you're not wearing masks, you are not doing the right thing. There is nothing magical about midnight tonight. Tomorrow is a holiday for most people. I encourage you to spend it peacefully with a small group of people like your family tonight. Let midnight pass and let's move on. We had trouble over the summer when we had Memorial Day and 4th of July back to back. That is nothing like having Thanksgiving on top of Christmas, on top of New Year's. Please, do the right thing. Give the healthcare workers a break. Allow us to get some time between us and these holidays. Allow us the opportunity to get to a new normal earlier by doing the right thing tonight. Thank you.
Thanks, everyone. We'll see you back here on Tuesday.